Welcome to the spoken tutorial on hand expression of breast milk. In this tutorial, we will learn benefits of expressing breast milk, how to express breast milk by hand, and how often should a mother express breast milk. Breast milk expression is useful to relieve breast engorgement, to treat nipple soreness and dry skin on the dark area around the nipple, to feed a baby if mother's sore nipple is extremely painful while latching, to increase or maintain mother's breast milk supply, to keep breast milk available for a baby when the mother goes out or to work, to help a baby to attach to a full breast by softening the dark area around the nipple, to check whether the baby has fed from one breast completely before offering the other breast, to make nutritious complementary food for a baby by using breast milk instead of water or cow's milk, and to help in feeding milk to premature babies, sick babies, babies with poor muscle tone, babies with cleft lip and or palate, and babies who have difficulty in latching deeply to the breast. Now, let's learn how to express breast milk. The most recommended way for a mother to express breast milk is by using her hand, because this method causes less discomfort to the dark area around the nipple. Also, this method needs no appliance, so the mother can do it anywhere and at any time. Expressing breast milk by hand is a learned skill and will improve with practice. It is easy to hand express breast milk when the breasts are soft. Therefore, a mother should learn this skill on the first or second day after delivery. Before expressing breast milk, mother should have a steel or glass container ready to collect the expressed milk. She should choose a cup, glass, jug, or jar with a wide mouth. She should wash the chosen container in soap and water. After that, she should either keep the container in boiling water or pour boiling water into the container and leave it for a few minutes. Then, she should either air dry the container completely or wipe it dry with an unused clean cloth. The container should never be dried with a used cloth, such as a used kitchen cloth. After the clean container is dried completely, next step is to release breast milk from the breast. To help her milk flow, the mother should feel relaxed and emotionally connected to her baby. Mother can try the following. She can sit quietly and privately or with a supportive friend. Some mothers can express easily in a group of other mothers who are also expressing breast milk. She can hold her baby on her lap with skin-to-skin contact, or she can look at her baby or hear her baby's voice. Sometimes, even looking at a photograph of her baby or smelling her baby's clothing helps. She can take a warm, soothing drink, but the drink should not be coffee, strong tea, alcohol, or any stimulant. She can also warm her breast to help her milk flow. To warm her breast, she can apply a cloth soaked in hot water to her breast or have a warm water bath. She can stimulate her nipples and the dark area around them by gently pulling or rolling them with her fingers. She can massage her breast lightly using circular movements. Mother can ask a helper to rub her back. For the back rub, the mother should sit down, lean forward, fold her arms on a table in front of her, and rest her head on her arms. Her breast should be unclothed and hanging loose. The helper should rub down both sides of the mother's spine. She should use her closed fist with her thumbs pointing forward. She should press firmly, making small, circular movements with her thumbs. She should work down both sides of the spine at the same time from the neck to the shoulder blades. She should do this for 2 to 3 minutes. All these steps will help in releasing the breast milk. This release of breast milk is called oxytocin reflex or let down reflex. After the oxytocin reflex begins, the mother must wash and dry her hands thoroughly. Then, the mother should sit comfortably. She should lean forward slightly. She should hold the container near her breast. Now, she should place her thumb and fingers on the breast in a C-shape hold from the side. She can use either hand for holding either breast, and she can switch to the other hand when the first one tires. While holding the breast, her thumb should be on the upper part of the breast, and her fingers should be placed opposite to the thumb on the lower part of the breast. Her thumb, nipple, and fingers should always be in a straight line, and the nipple should be in the middle of the thumb and the index finger. There should be a distance of 2 fingers between the nipple and her thumb and the nipple and her fingers. If the fingers are too close to the nipple, the milk may not flow for long. Mother will release more milk when she compresses the milk ducts beneath the dark area around the nipple. In this picture, the mother is holding her right breast correctly with her right hand. Now, she should press the breast slightly inwards towards the chest wall by applying steady pressure. Then, without moving the hand, gently compress the breast between the thumb and the fingers, and then release the pressure on the breast. The mother should repeat these 3 steps: press back, compress, and release. The first step of pressing back towards the chest wall is an important step. Pressing only towards the nipple will give very little milk. But when the breast is pressed back, milk from the dense breast tissue is released. But avoid pressing too far back because that can block the milk ducts. When the mother starts expressing breast milk by hand, very few drops of milk may come out at first. As the let-down reflex starts, milk starts to drip out. In the first few attempts, it is common for the milk to drip out or come slowly. Later, breast milk may flow in streams. As with breastfeeding, expressing breast milk is a skill that comes with practice. Colostrum, the first milk after birth, may only come in drops, but is enough for the newborn. The thick, often yellow milk has enormous protective benefits for the baby. The mother should repeat the 3 steps until the flow of milk slows down to a drip again. Then, she should reposition her fingers to express milk from other parts of the breast. She can feel for where the breast seems fuller and compress those areas. She should express milk from one breast for at least 3 to 5 minutes until the milk flow slows down. Then, she should express milk from the other breast in the same way from all the areas. And then again express milk from both breasts a second time. Expressing breast milk from both breasts adequately takes 20 to 30 minutes. It may take more time, especially in the first few days. as in those days, only a little milk may be produced. It is important not to try to express in a shorter time. Remember, expressing breast milk by hand should not hurt. If it hurts, the technique is wrong. Breast tissue is delicate. Avoid rubbing, sliding, or pulling the fingers along the skin towards the nipple. This can cause breast soreness. Avoid tightening or stretching the skin over the dark area around the nipple. Also, avoid squeezing or pulling the nipple. Pressing or pulling the nipple cannot express enough milk. It is the same as the baby sucking only the nipple. After expressing breast milk, the mother should cover the container with a clean cloth or plate. Then, she should store her breast milk safely for later use. Safe storage of breast milk and feeding stored breast milk to the baby are explained in another tutorial. Let's now discuss how often a mother should express milk. If the purpose is to initiate and maintain breast milk production, or to feed a low birth weight baby or sick newborn baby, then she should express milk as soon as possible after delivery. She may only express a few drops of colostrum at first. This helps breast milk production to begin. It acts similar to a baby suckling soon after delivery. The mother should express as much as she can and as often as her baby would breastfeed. This should be at least every 2 to 3 hours, including during the night. If there are long intervals between expressions, she may not be able to produce enough milk. Next, if the purpose is to build up mother's milk supply, and if it seems to be decreasing after a few weeks, she should express breast milk every 1 to 2 hours immediately after breastfeeding the baby, and if the baby is expected to sleep for more than 3 hours, then she can express in between feeds. If the purpose is to relieve symptoms such as engorgement or leaking of breast milk at work, the mother should express only as much as is necessary. If the purpose is to keep nipple skin healthy, the mother should express a small drop of breast milk to rub on her nipple. She should do this after a bath and after breastfeeding. If the purpose is to keep milk for her baby while the mother is out at work, the mother should express milk while at work to help keep up the supply, and the mother should express breast milk before going to work and leave it for the carer to give to the baby. For doing this, mother can plan few weeks ahead if she has a fridge. She can express extra milk and store it for later use. Mother can express even after the baby has breastfed. Mother should leave about 60 to 90 milliliters of milk for each feed. More breast milk can be given as per baby's need while mother is away. Remember, the more frequent hand expression is used, the easier it becomes to express milk, the faster the milk releases, and the more milk mother will make. This brings us to the end of this tutorial. Thank you for joining.